My name's Mark Garrett, and I'm a Medicare specialist agent. In other words, I'm an insurance agent who specializes in Medicare, and what I'm going to talk to you about today is why you should have a Medicare supplement. It's a real simple and easy choice. Actually, the math makes it a very simple and easy choice. No matter what your income is, it is the best option for you. So what we're going to start with is, what is it about a Medicare supplement, and what is a Medicare supplement, and what makes it the best for you? So Medicare supplements are also called Medigap plans. In other words, they pay the gap in between what Medicare covers and what you would have to pay. So Medicare covers 80%, you would be left with 20%. The Medigap plan fills that in for you. It fills in the deductibles for hospitals, it fills in the payments for skilled nursing facilities, for MRIs, for medical equipment, everything that you would be left paying that Medicare didn't. A Medicare supplement is going to take care of that for you. So one of the key things about Medicare supplement plans that makes them really nice is there's only 11 of them in the United States. That means there's a letter A going through the letter N. There's 11 plans. They're all standardized by the federal government. And what makes it great, as you can see in this illustration, every G plan is represented by a different company, but they're all exactly the same in the core benefits. So there's no difference in benefits no matter what company you go with, only the price is what varies in between companies. So an important thing to remember with a Medicare supplement is they have absolutely no networks. In other words, any hospital, doctor, MRI facility, any type of medical provider, home health, skilled nursing facility that accepts Medicare, they're going to accept your Medicare supplement. Not always the case with the Medicare Advantage, but with a Medicare supplement, there are no networks. Anyone who accepts Medicare in the United States, that's roughly 97 to 99% of all providers, they will also accept your supplement with no questions asked whatsoever, because the only job of that supplement is to pay whatever your Medicare did not pay. So with that being said, Medicare supplements are the preferred insurance for doctors, hospitals, home health, skilled nursing facilities. Actually, any medical provider out there, if you called up and talked to their billing office, would tell you, yes, we love Medicare supplements. If you called them up and asked them about Medicare Advantage, you're probably not going to hear the same reply, because a lot of providers out there won't accept Medicare Advantage today, therefore limiting you on the choices of who you can see to attain your medical care. Now, the next thing you need to remember is that Medicare supplements are the best option for all people on a fixed budget and not on a fixed budget. And the answer is why. It's simple. It's because it's no unexpected cost. If you know that you're going to pay $110 every month or $130 every month, and you know that all of your medical care is going to be taken care of, you're not going to be billed for anything, and everybody's going to accept that. That's a lot easier than having to find providers that accept your insurance, like with a Medicare Advantage, and finding out that you have different co-payments for every service that you could possibly get. So let's talk about what Medicare supplements are not. And as you've heard me mention in this video, Medicare supplements are not the same thing as a Medicare Advantage. Often those are referred to as Medicare Disadvantage plans, because there are so many limitations. There are so many doctors that won't take it. There are so many co-payments that you have to come up with out of your pocket on a Medicare Advantage that you're not going to experience when you have a Medicare supplement. So one of the first things about a Medicare Advantage is there are over 2,200 plans in the United States versus 11 for Medicare supplements. 2,200 Medicare Advantage plans. They come in every flavor you can possibly imagine. They have them in all the different cities, counties, states. They vary on what benefits they have in them. So you really have to do a lot of research to determine, hey, which one of these many Medicare Advantage plans offered in my state and in my county and in my city is the best option for me. And it might be that they're not the best option at all because your providers are not within network. So the next thing you need to remember about a Medicare Advantage plans is you have co-payments for everything. They do not cover the gap. They are not Medigap plans. In other words, whatever Medicare doesn't pay, you're going to be left paying a certain portion of that, because that's what Medicare Advantage plans do. They assign back to you co-payments on every service you have, be it doctor's visits or MRIs or CTs, ultrasounds, whether you go to a skilled nursing facility or you go to a durable medical equipment company or home health, anything that you have done, surgeries, inpatient, outpatient, there's usually a fee attached to it that you're going to be responsible for paying with a Medicare Advantage. The other thing is Medicare Advantage plans have a yearly out-of-pocket maximum between $3,500 to $6,700. There's no fixed cost, so you cannot budget your money. In other words, you may be paying $0 for the HMO, which is your last option I would recommend. You may be paying $50 to $110 for your PPO, but you're going to have to pay out of pocket for all those things that I mentioned. And at the end of the day, when you've reached that $3,500 to $6,700 out of your pocket in that calendar year, the plan will pick up everything. But by that point in time, you've already gone thousands of dollars over what you would have paid to have a Medicare supplement just by paying a monthly premium, and everything would have been paid. So Medicare Advantage plans have networks, and they're often very small. According to some U.S. county statistics, it is shown that the participation rate of physicians and hospitals and ancillary services as low as 13.7% in some counties. Now in other counties it's much higher. I don't want to paint doom and gloom, but you're never going to get much over the 60 to 70% range in the amount of providers that participate in a Medicare Advantage plan, just because they get paid much less than they do from someone who has original Medicare and a Medicare supplement. If you're a doctor, you went to school all those years, you definitely want to get compensated for the services you provide to people. So Medicare Advantage plans have co-payments for everything, including doctor's visits, hospitalizations, MRIs, surgeries, physical therapy, durable medical equipment, and the list goes on and on. It's just like throwing money out the window, except you don't have a smile on your face, you have a frown on your face. So let's do the math real quick. So with a Medicare Advantage HMO, and you pay $0 to $20 per month premium, let's say, and probably $6,700 is going to be your out-of-pocket maximum in a year. Your primary care visits are between $0 to $10, and you have a specialist that's between $10 to $25 that you have to make a copayment for. So you have to realize that HMOs have the least amount of participation upon providers in your area that are going to accept an HMO. Doctors, facilities, hospitals, they just don't like HMOs because of the poor reimbursement. So you may be getting it for next to nothing, but you're getting poor choices to go with it. And you're going to have co-payments on everything, and you could be at $6,700 at the end of the year with a couple of critical illnesses throughout the year that hospitalize you, require surgery, and other things. The next thing you got to look at is a Medicare Advantage PPO, which I do sell PPOs to people, and there are some PPOs that are decent. But the thing about a PPO you have to remember is some places they cost $0, but in most states I find that they cost anywhere from $25 up to $190 in premium, and that's for a Medicare Advantage PPO. They probably have a $5,000 out-of-pocket maximum. It's usually a little bit less with a PPO. Your primary is usually going to start out at $15 for a primary care visit, and a specialist is probably going to cost you $40 plus, $40 to $50. Plus you're still going to have all the co-payments for hospital stays, physical therapy, surgeries, MRIs. Once again, co-payments that may amount to a lot of money. The last thing, math-wise, is a Medicare supplement. So with a Medicare supplement, depending on the state you live in, you could spend anywhere from $90 for a Plan N up to $180 for a Plan F. The bottom line is that there is no out-of-pocket with most, like a Plan F has nothing. You pay a monthly premium, that's it, and you're done. A Plan F starting in Texas at 65 years of age is probably going to cost you about $140 a month, but you don't pay anything but that monthly premium. Specialist visits cost you nothing. Your primary costs you nothing. If you have a Plan N or a Plan G, once you've met the $183 deductible at the beginning of the year for Part B, you have no payments throughout the rest of the year for Plan G, and maybe a $20 copayment to go to the doctor throughout the year. They're a great plan, by the way, for people who don't utilize the doctor's office a lot when it comes to Medicare supplements, because they're really cheap and they pay just about everything. With Plan F, you pay nothing but the premium. Plan G, you only pay the $183 Part B deductible. Plan N, you're going to pay the deductible and a $20 copayment for doctor's visits. You really need to give us a call, and we'll be happy to go over and set the parameters with you of what you can expect and what the price is in your particular state and county, because we do sell everywhere. So, which are you better prepared for? Are you better prepared for $110 a month times 12 months? That's going to be $1,320 for a Medicare supplement Plan G for a 65-year-old. Or you better plan for a $69 per month times 12 months. That's $828. That's a Medicare Advantage PPO with all the out-of-pocket costs still to come. If you do not have an extra $200 for that MRI copayment, don't worry, you're not going to be able to get the MRI because they want cash payment up front for that. Can you easily come up with the $5,000 to $6,700 out of pocket? I don't know. You have to ask yourself if you have that money banked away. All of us would like to think we have our money banked away for a rainy day, but I come to find that very few people actually have that money banked away. So stop wasting your money. Call us today, 800-708-5810, or go to our website at nationalseniorsavings.com. We'll give you a free quote, enter your information. We'll get back to you on that. We never, and I mean we never, have a charge for our services. We sell for all the companies in your state, and we sell for thousands of clients. We actually help our clients, thousands of them, get what they need. We sell for probably about 30 to 40 companies in the Medicare supplement arena, and of those we usually go to find what's the best price with the best company for you. Call us if you like this video. Please subscribe, share it with friends. We welcome your feedback. Anything you want to know from us, let us know. We're here to help you. Once again, my name is Mark Garrett. I'm the owner at National Senior Savings. You have a wonderful day.